Good day, everyone. My name is Mr. Chisholm. Today, we'll be looking at this bone here, which is known as the femur. So, this is known as the femur. So, the femur is referred to as the longest bone in the body and also the strongest bone in the body. It is the bone of the thigh, and it is a long bone. The type of bone it is a long bone. So, this is the femur. These two bones here are the femurs. So we'll be looking at the features of the femur. We'll be looking at the features one after the other. So generally, the femur is divided into three parts. We have this part, which is known as the proximal part. We have the body or the shaft, and we have the distal part. The proximal part, the body or shaft, and the distal parts. So we'll be looking at these features one after the other. We'll be looking at the features in these parts one after the other. So the first feature in the proximal part is this rounded part here. So this rounded part here is known as the head of the femur. So this head of the femur articulates with the acetabulum of the pelvic bone to form the hip joint. So you can see the pelvic bone, and this is the acetabular fossa of the pelvic bone. So you can see how the head of the femur articulates with it to form the hip joint. So that is it for the head of the femur. So at the middle of the head of the femur, there is a small depression or a small hole that is found here. And if you also check this one, you see this depression here. This is known as the fovea capitis femoris, or the fovea for the ligament of the head of the femur. So it is known as the fovea capitis femoris, or the fovea for the ligament of the head of the femur. So this is where the ligament of the head of the femur attaches. So that is it. Then having seen that, let's look at other features. There is a line here. You can see this line surrounding the head of the femur. This line surrounding the head of the femur is the line that gave attachment to the synovial membrane. So you can see this line here surrounding the head of the femur. It is the line that gave attachment to the synovial membrane. And here is the neck of the femur. This is the neck of the femur around here. Then having seen the neck of the femur, just at the terminal point of the neck of the femur, there is a line here. There is a line here. This is it. This line here, at the terminal end of the neck of the femur, anteriorly, there is a line here. And this line is the line that gave attachment to the fibrous capsule, or the joint capsule of the hip joint. So this line is known as the intertrochanteric line. The intertrochanteric line gave attachment to the joint capsule of the hip joint. So that is it. Then having seen this feature, let's go over to this feature here. You see this protrusion, this big protrusion here, and the smaller one here. If you look at this bone, you also see the protrusion here, and you also see the smaller one here. This bigger one is known as the greater trochanter of the femur, while the smaller one is known as the lesser trochanter of the femur. So this is the greater trochanter of the femur. This is the lesser trochanter of the femur. Then in the greater trochanter of the femur, there is a hole there. In the greater trochanter of the femur, there is a hole here. And this hole is known as the trochanteric fossa. So you can see the trochanteric fossa here. Then having seen the trochanteric fossa, between the greater trochanter and the lesser trochanter, there is another line here, or another protrusion here, that runs from the greater trochanter down to the lesser trochanter posteriorly. You know, the line that runs from the greater trochanter to the lesser trochanter anteriorly is known as the intertrochanteric line anteriorly, which is this. That is different from this line that runs from the greater trochanter to the lesser trochanter posteriorly. So this line is known as the intertrochanteric crest. This is the intertrochanteric crest. And around here, there is a protrusion around here. In this line, or in this crest, there is a protrusion here. And this protrusion is known as the quadrate tubercle. This is known as the quadrate tubercle. So I will show us this feature in this bone. This is the quadrate tubercle here. And from here to here is the intertrochanteric crest. Then having seen that, let's go over to another feature. So if you come to the anterior aspect of the anterior aspect of the proximal aspect of the femur, if you turn to the anterior surface, you remember that the intertrochanteric line runs from the greater trochanter to the lesser trochanter anteriorly. But if you notice, just beside the lesser trochanter, there is another line here. If you can observe this line here, this is known as the pectineal line. This is known as the pectineal line. The pectineal line, this is the point of insertion of the pectineus muscle. So the pectineus muscle inserts here. Then having seen that, if you turn to the posterior aspect, you will see the gluteal tuberosity here. This is the gluteal tuberosity here, just inferior to the greater trochanter. There is a protrusion here known as the gluteal tuberosity. It may not be so prominent in this bone, but if you look at this bone, you see the gluteal tuberosity here. So this gluteal tuberosity is the point of attachment of the gluteus maximus muscle. Then having seen that, we've been able to see the fissures in the proximal part of the femur. Let's go over to the shaft or the body of the femur. So, you know that I told us that this is the anterior surface of the femur. This is the medial surface of the femur. This is the lateral surface of the femur. And this is the posterior surface of the femur. So if you come to the posterior surface of the femur, from this tubercle here, gluteal tubercle, there is a line that extends inferiorly. And there is another line from the lesser trochanter that comes inferiorly. So this line comes medially, while this line comes laterally. And the both of them meet at the shaft here. So you can see the both of them meet together here. You see the medial line and you see the lateral line, and the both of them meet together. This line here is known as the linea aspera. This is the linear aspera. This is the medial lip of the linear aspera, while this is the lateral lip of the linear aspera. So the both of them join together. The both of them join together here to form the linear aspera. So this linear aspera gave origin to the vastus medialis muscle and vastus lateralis muscle. Then it gave insertion to the adductor longus, adductor brevis, and adductor magnus muscle. Then coming down inferiorly, you notice that the linear aspera splits into two lines. You see this line on the medial part and this line on the lateral part. The line on the medial part is known as the medial supracondylar line, while the one on the lateral part is known as the lateral supracondylar line. So this is the lateral supracondylar line. This is the medial supracondylar line. And as a matter of fact, this is the posterior surface that we are still treating or dealing on. So just inferior to the medial and the lateral supracondylar lines, there is a surface here. There is a triangular surface here. This triangular surface is known as the popliteal surface. This is known as the popliteal surface. Then having seen that, there is a protrusion on top of the medial part of the femur, distal part of the femur here. There is a protrusion here, and this protrusion is known as the adductus tubercle. So this is the adductus tubercle, and it gave attachment to the adductor magnus muscle. It gave attachment to the adductor magnus muscle. Then we can also look at this. This is the adductus tubercle on the medial aspect. So this is it. On the medial aspect, this is the adductus tubercle, which gave attachment to the adductor magnus muscle. Then, having seen that, this wheel-like part, these two parts here, this one on the lateral side is known as the lateral condyle of the femur, while this one on the medial part is known as the medial condyle of the femur. This is it. Lateral and the medial condyles of the femur. So between the lateral and the medial condyle of the femur, there is a depression here. And this depression is known as the intercondylar fossa. This is known as the intercondylar fossa. So, as a matter of fact, the medial and the lateral condyle of the femur, they articulate with the medial and the lateral articular, superior articular surfaces of the tibia to form the knee joint together with the patella. So this lateral condyle and the medial condyle of the femur together with the two superior articular surfaces of the tibia articulate together with the patella to form the knee joint. So this is what we mean. You can see how it's joined here to form the knee joint. So this is the posterior aspect. If you come to the anterior aspect, you can still see it. And this is the patella here to form the knee joint. So having seen that, coming to the medial aspect of the distal part of the femur, there is another protrusion just below the adductus tubercle here. There is another protrusion here, and this protrusion is known as the medial epicondyle of the femur. Notice the difference between the adductus tubercle and the medial epicondyle. This is the adductus tubercle, and this is the medial epicondyle. Adductus tubercle is at the top, while the medial epicondyle is just below it. Then if you turn to the lateral side, you see the lateral epicondyle of the femur. Then having seen that, if you turn to the anterior surface of the femur, of the distal femur, you see this surface here. This is known as the patellar surface. This is known as the patellar surface. It is this surface that the patella lies. So this is the patella, and this is it. This is how it lies in this surface, together with the tibia to form the knee joint. So this is it. So having seen that, there is another important feature here. If you look at just beside the linear aspera on the posterior surface of the femur, there is a hole here. This hole is known as the nutrient foramen. It is known as the nutrient foramen. So that is all the features in the femur. That is all the features in the femur. So I'll be doing a recap of what I've said so far. I'll be doing a recap of what I've said so far. So I told us that the femur is the largest and the longest and the strongest bone in the body. So the femur is divided into three parts: the proximal part, the body, and the distal part. The proximal part, the body or the shaft, and the distal part. So I showed us the head of the femur, the fovea capitis femoris, which is where the ligament for the head of the femur lies. So this is it. Then I showed us where the synovial membrane lie. This line here is where the synovial membrane attaches. This is the neck of the femur. Then this is the greater trochanter, the lesser trochanter, the intertrochanteric line. This is the greater trochanter, the lesser trochanter, the intertrochanteric crest. Then at the middle here you have the quadrate tubercle. Then in the greater trochanter we have the trochanteric fossa. Then on the anterior aspect between the greater trochanter and the lesser trochanter, on the anterior aspect we have this line here, which is the intertrochanteric line, which gave attachment to the joint capsule, the fibrous joint capsule. Then having seen that, coming to this line here, I told us that it is known as the pectineal line that gave attachment to the pectineus muscle. Then this is the body or the shaft of the femur. This is the anterior shaft of the femur. This is the anterior shaft of the femur. Then this is the medial surface. This is the anterior surface of the femur. I forgot to say that this is the anterior surface of the femur. This is the medial surface of the femur. This is the lateral surface of the femur. And here is the posterior surface of the femur. Anterior surface, medial surface, lateral surface, and posterior surface of the femur. Then I told us about the linear aspera, both the lateral lip and the medial rib. And I also told us about the gluteal tuberosity here. The gluteal tuberosity here. Then, having seen that, you come over to the distal part. We have the popliteal surface here. Having seen the popliteal surface, I told us about the adductus tubercle on the medial side here, the medial epicondyle, the lateral epicondyle, then the medial supracondylar line, the lateral supracondylar line. Then I told us about the lateral condyle of the femur and the medial condyle of the femur, the intercondylar fossa here. Then if you come to the anterior aspect, you see the patellar surface here. So we've come to the end of this teaching. I will encourage us to subscribe to my YouTube channel, Learn with Chisom Great. Follow me on Facebook, Learn with Chisom Great. Follow me on TikTok, Chisom_Great. Then like this video, share this video to your friends, and comment on this video. Thank you very much.